Hi guys, I'm Ariana Destiny, and I had the opportunity to interview Dr. Gerda Augustine, a physician with an MD degree, and she has a MPH, which means Master of Public Health. She's also known as the CEO of the nonprofit called Destiny Outreach Center in Blackwood, New Jersey. Dr. Augustine works in her private office where she sees patients who have issues with substance abuse. She provides them with certain medication after reviewing the patient's chart, history, mental health history, and substance abuse history. Then she gives the medication, which I think can correctly be called. This helps patients who have a history of substance abuse by providing the help they need with those issues. That's what she currently does in her office. Dr. Augustine feels rewarded when patients keep up with their follow-up appointments and stay in the program by following up with the counselor and the appointment she also gets. She's also happy when she sees that patients stay away from the substance that was affecting their lives, that they're in full recovery, and that they're getting their lives back together. One of the challenges Dr. Augustine discussed during the interview was when a patient has a lot of substance abuse issues, plus mental health issues. Those two together can make it very difficult to treat that kind of patient and work with them. She also finds it challenging to meet with the patients that do not show up for the appointments or the counseling sessions, which affect the outcome of the treatment plan for those patients. So that's the challenge she sometimes faces with the patients who do not keep up with their appointments. It's also challenging to help the patient, as she says, if they're not coming to the office or keeping their appointment. Keeping the appointment to see how Dr. Augustine does it is important, as well as keeping an appointment with the counselor section, because that's an important part of the whole substance abuse treatment plan. Another challenge she mentioned is treating patients who have multiple substance abuse issues. So those patients that are not only ones using it. One substance is they have a history of multiple substances, so it's a challenge to treat all those patients because these patients tend to relapse, which is very sad, as she describes. And that recovery became very challenging to reach them. As a physician, Dr. Augustine does two things to keep up to date when it comes to her education in her fields. So she does what's called CME, describing as continuous medical education. That's where she attended in-person conversation that focuses on substance abuse, addiction, and medication. She also does continue education online, which helps her with different updates that has been discussed. By doing those conferences, either in person or online, she's able to stay up to date on the latest treatment plans that have been worked for different kinds of patients with different types of problems. The CUM, meaning Carnegie Mellon University, also helped her. She's learned a lot from other physicians because when she goes there, she listens to the other physicians' ways of doing or treating certain patients. Those treatments also help her change things in her practice to help her patients. So she enjoys going to CME for conferences or online because she said it helps her learn a lot from the colleagues of hers. So when I asked her what she would suggest to me about her recommendations, she suggested the recommendation would be to do an internship either at mental health facility or a place I plan to do counseling with patients that have mental issues. She said it would be a good opportunity to get the hang of things and get first-hand experience if that's the field that I want to go to. It's important that I go there to follow people and see how the interview is being done. Counseling is being done, and so on for terms of what I've learned. It was very interesting. I was pleased to get the opportunity to talk to Dr. Augustine, who explained to me how she treated her patients with substance abuse. I've never had an interview with a physician before, especially a physician that had. They have been working in the field for many years with patients who have a lot of issues, such as substance abuse. So it was a learning experience to answer questions, and she was so kind to answer those questions and things that are like. So I enjoyed most of my time learning from her. It sounded like a challenge at first, but it's also rewarding when you help people. So I appreciate that she enjoyed helping those who have substance issues, even though it's challenging to get those patients on board. When they're on board and to stay on the program, they recover and got their lives back. I hope that someday I'll be helping people too, in my own way, of course. It was very interesting for an interview, and I enjoyed it. Thank you.